Well, squamous cell carcinoma of the skin is also known as cutaneous squamous cell carcinoma. This is distinguished from head and neck squamous cell carcinoma, which sometimes is called oral mucosal squamous cell carcinoma, and the latter has a different etiology, whereas the skin squamous cell carcinoma is a ultraviolet damage disease for the most part. The non-skin head and neck oral mucosal disease is other etiology, could be human papillomavirus. So that's the big difference. So the skin cancers in general are three main types. You have melanoma, then you have your non-melanoma. Your non-melanoma skin cancers are predominantly, the two most common ones are basal cell carcinoma, the most common, and squamous cell carcinoma, the second most common, both skin cancers. Approximately 80% are basal cell carcinoma and approximately 20% are squamous cell carcinoma. And it's hard to know, good numbers for incidence and prevalence because of the fact that especially cutaneous squamous cell carcinoma is not found as part of cancer registries, although the numbers that we do have show us that approximately 3.5 million cases per year, incidence based on some data from some years ago. It may be higher than that now. And if you use 20%, that gives you 700,000 cases of cutaneous squamous cell carcinoma a year. The vast majority of these, approximately 95%, are curable with surgery alone, completely removed. Of course, the others that aren't can become advanced, and advanced is an umbrella term that includes locally advanced contiguous disease, which can be quite extensive and is also potentially life-threatening, as well as metastatic disease. The two broad categories of metastatic disease include the local regional, such as neck lymph nodes or parotid lymph nodes, or the distant metastasis, such as distant organ or bone. Although the majority of these non-melanoma skin cancers are cured completely with surgery, either locally, wide local excision or Mohs surgery being a more precise surgical technique with a higher cure rate, there are some that can progress and become advanced and can even lead to death. Both basal cell and squamous cell carcinoma can produce death, both locally advanced and metastatic disease, not just metastatic disease. The estimated death from cutaneous squamous cell carcinoma ranges from approximately 3,900 to around 8,700 cases per year, and that's a lot of deaths.